We are here at Dr. Montigut's office. Dr. Montigut is a renowned plastic surgeon, has done a lot of work in the area of fat transfer. My name is Habib Torfi. I'm with Invitrex. We are a biotech slash stem cell company. We are here to discuss the application and the clinical use of adipose drive or adult stem cell in plastic and cosmetic surgery. Dr. Montigut, thank you so much for taking time to meet with us. If you could perhaps give us your understanding of where this field is and where the field is going to go moving forward.
Okay, thank you. Stem cells, as far as we know presently, it's new technology and it's in the forefront of what we're doing. At this point in time, fat cells are almost considered to be stem cells. They're close to what a stem cell is, but Invitrex takes it a little bit further and actually isolates pure stem cells from the patient's own fat. Fat injections in the last 5-10 years have become part of the new frontier of plastic surgery as far as filling volume. It has a new role in science and the way it acts in the human body. Stem cells, as we know, and Habib can, I'll let him explain a little bit more about the science of stem cells, but you're taking a brand new cell in the body. He isolates that stem cell. That stem cell is a pure cell that goes through the body and can do repair work in the body for any type of problems. Presently, we can use it in isolated procedures such as cosmetic surgery and things like that.
Start again.
I'm going to turn it over to Habib and let Habib explain a little bit about the science of stem cells and what Invitrex does.
Thank you so much. Again, to briefly review the science here, stem cells, for all intents and purposes, are three types. One are the embryonic stem cells. Then we have fetal stem cells like cord blood. A lot of you have probably heard people who store cord blood of their fetuses or their child. And then thirdly and lastly, we are, and Invitrex is in the business of autologous fat stem cell. Autologous meaning your own cells. That means we take your own cells, isolate the cells right there in the clinic, and are used by surgeons like Dr. Montigut to remedy, in this case, a cosmetic or an aesthetic procedure. So from a ethical standpoint and from a clinical standpoint, these type of stem cells are safe since you are using your own stem cells, and we are applying these cells in a sterile environment. And again, I like to indicate here that stem cell is going to shift the paradigm of how we are going to practice medicine. Cosmetic, orthopedics, and other area of disease or treatment will be the next frontier. And we, no pun intended, stem cell is embryonic. We are learning the science. We are beginning to see how we can use this stem cell in areas that today's medicine cannot respond. In COPD, after a patient has a heart attack, stroke, among other diagnoses, are going to be areas that hopefully we can use these stem cells to help some of these patients reduce their pain and also add quality to their life. So at this point, I like Dr. Montigut to really expand on this brief scientific review that we gave to see how this is going to basically impact your practice and your patients which come to you with certain diseases or conditions.
In using stem cells prepared by Invitrex, you're taking the patient's fat, reducing it to pure stem cells, the patient's own stem cells. When that's put into the procedure, for example, a facelift, and utilizing surgical means of a facelift along with fat injections, then what happens is we've noted that there's reduced swelling, it's faster healing, a lot less inflammation and discomfort. What can possibly be anticipated for the future is because the stem cells are cells that try to repair the body. Like after a heart attack, stem cells can actually go in and begin a repair process on damaged muscle. When you use it in cosmetic procedures or any types of procedures, you're taking a young, brand new cell that's programmed to do repair work in the body. Henceforth, on the facelift patient that was recently done, it was noted that the incisions healed faster. She's less swollen. Her bruising disappeared quicker than the normal patient. Particularly when we did fat injections to her hands demonstrated no signs of any swelling whatsoever. In the long run, fat can live transplanted as fat, the procedure fat transfer of fat injections. However, if you add the stem cells to it, then you have a higher component of what's going to live, and it reduces all of the possible complications from having surgery, and the patient appears to be healing faster and doing better. In the long run, we can anticipate maybe changes in the skin texture and other areas of her body that need repair work. So, I mean, the forefront and the future of stem cells is very bright, and it's the here and now.
Dr. Montigut, thank you so much for your input and your insight, and we definitely have started our relationship and look forward to working with you and your office to help some of these patients as they come through your doors.
It's very exciting, so the future's here.
Thank you so much.